I'm Dan Blackman, clinical psychologist with Durham and Dale's Clinical Psychology. And today I'm going to address the frequently asked question of what is a clinical psychologist and what does one do? Well, first of all, we're psychologists, having completed a first degree in psychology. But beyond this, we're healthcare professionals who've completed an NHS based doctoral level training that equips us to understand and intervene effectively with people who have got problems in areas such as mental performance, which might involve things like memory and attention, behavior. So, this could be something like an adult with a problematic pattern of behavior that repeats in their personal relationships and or at work, and also in the area of emotion. So we would work with problems like depression, anxiety, and trauma. In terms of what do we do, it differs depending on the population you work with. Clinical psychologists have a broad training, so we can work with children, adults, older adults, and people with learning disabilities. So what you do depends largely on which group you work with. But there are some core skills that all clinical psychologists would use on a daily basis. Now, the first of these is assessment. So, our training covers different types of interviews and observation methods that help us to build up an accurate picture of problems that a person is experiencing. And also, we're training psychometric testing. So, this could be something as straightforward as a simple measure measuring the severity of symptoms of depression and anxiety, or a much more in depth assessment um, looking at a person's intellectual ability or the structure of their personality. Another core competency of all clinical psychologists is a process called formulation, which essentially could be viewed as building up of a map that details what is keeping a person's problems going, what are the different factors that are involved, and how are they interacting with each other. It's essentially a series of hypotheses about what is causing a person's distress. We would develop these hypotheses and this map with the patient wherever possible, and bring our own expertise to that as well as what the patient is bringing. Um, uh, Formulation will evolve as we get to know someone better and we get to understand the problems that they experience in more detail. We also intervene. So, intervention is another core skill of clinical psychology, and the way in which you intervene very much depends on who you work with and where you work. But for me, working in adult mental health, I intervene by applying a range of psychotherapeutic models to alleviate a person's distress. So, my training covered cognitive behavioral therapy, cognitive analytic therapy, psychodynamic psychotherapy, and systemic psychotherapy. So I would draw on these different models to work with a person and the problems that they're having. Evaluation is another core skill, which is similar to assessment, using interviews, observations to determine the degree to which an intervention is having the effect that we would hope it would have. So we might talk to people and ask them about their subjective impressions of that. We might also compare statistically responses across questionnaires at the start of treatment at various points throughout treatment. Um, Another core area is supervision. Clinical psychologists are specialists in supervising other mental health professionals, particularly those who are trained to work within a single therapeutic approach, such as cognitive behavioral therapy or person centered counseling. Because we have a broader training, these professionals may often consult with us to try and help them understand some of the factors that might be at play with cases that they're feeling stuck with, so that we can help them move on in their treatment. Also, we're specialists in research. So we're trained to understand and use research so that the way in which we work with people is informed by evidence. But we're also trained to conduct research, which might be quite practical, looking at whether a service is performing as we would hope, or it might be more ambitious research in a peer-reviewed journal, which is aiming to help us understand a particular mental health condition in more depth. So I think these are the main areas that I wanted to cover. So that addresses the question of what is a clinical psychologist and what does one do. I'm Dan Blackman with Durham and Dale's Clinical Psychology, www.ddcp.co.uk. Thank you.